Welcome. My name is Carlos Zayas. I am a transplant nephrologist at Prisma Health and medical director of the kidney and pancreas transplant program. I welcome you to this presentation on what to know about hepatitis C organ transplantation. First off, let's start saying that there are about 120,000 Americans waiting for the gift of a renal transplant. Unfortunately, the number of people willing to donate from living donation or to offer kidneys from deceased donors has remained stagnant over the last 2 decades. Scientists, transplant professionals, and the government had tried to increase the number of organ transplants through different avenues. The use of hepatitis C organs is a promising way to increase the number of available organs for patients on the waiting list. Hepatitis C organs can now be successfully used to increase the number of organ transplants available to our patients. Historically, hepatitis C kidneys have not been used for transplant. We have seen an increased number of hepatitis C donors due to the epidemic of opioids in the United States. In fact, nearly 30% of donors are now known to be hepatitis C positive, many of who are young donors with very excellent organs available. Advancements of the treatment of hepatitis C have made it possible, and now we successfully use positive hepatitis C positive organs for transplantation. What is hepatitis C? The hepatitis C virus was discovered in 1989 and is a liver infection that spreads through body fluids. The majority of those patients affected are young adults sharing needles. They're likely otherwise very healthy organ donors. The infection is mostly spread through blood-to-blood contact, such as blood transfusions or sharing contaminated hypodermic needles. The damage that occurs to the liver from hepatitis C infection happens over a long period of time. With advancements in the treatment for hepatitis C, we've seen a significant number of patients achieving complete cure of this virus. How does this affect you? The use of hepatitis C positive organs increases the number of available organ transplants. Since 2017, more programs in the United States have used hepatitis C positive organs successfully. Nearly all transplanted patients eliminated the virus after receiving anti-hepatitis C medications. Hepatitis C medications are taken over a period of 12 weeks with very few side effects and with a very high safety profile and standard. These drugs will be compatible with your anti-rejection medications. With more options available to you, your wait time for a transplant can be significantly shorter, sometimes by years. Let's look at the hepatitis C transplant roadmap. First off, a hepatitis C organ becomes available. An eligible patient is identified, maybe you. The patient receives a phone call with the organ offer. If the patient agrees to proceed, the organ is transplanted. After the transplant, your blood will be monitored for the presence of the hepatitis C virus. Once the hepatitis C virus is identified in your bloodstream, you will initiate antiviral therapy within 28 days of your organ transplant. This treatment will be continued for a total of 12 weeks or until eradication of the virus. After that, we'll continue to follow your blood to ensure that the virus had disappeared from your bloodstream. There are resources for your information and for learning purposes available through the New England Journal of Medicine and the Annals of Internal Medicine. What's next? A hepatitis C positive organ can be a good option for those awaiting transplant surgery. Signing this educational form allows us as your care team to notify UNOS regarding your willingness to receive a hepatitis C positive organ offer. By signing this form, you also confirm your understanding of the risks and benefits associated with the reception of a hepatitis C positive organ. Now, this is not a final commitment. You can still say no, and you will not be penalized in any way for not proceeding with a hepatitis C organ later on. You can change your preference at any time. We'll be happy to entertain any questions. Thank you so much for listening.